The DuPage County Health Department's Environmental Health Services carries out a variety of programs to promote healthy environmental conditions and reduce risks associated with communicable disease. Our role involves permitting and inspecting restaurants, food trucks, outdoor food festivals, swimming pools, care facilities, body art facilities, wells and septic systems, and carrying out mosquito surveillance for West Nile virus. Our focus is on enforcing regulations and educating food service workers and the public on important food safety practices and concepts. Our tasks include conducting inspections and investigating complaints of food facilities such as restaurants, grocery stores, bars, schools, care facilities, and other operations that sell or serve food. Environmental health specialists protect public health through a variety of different environmental health programs, including food safety. Each year, the DuPage County Health Department permits and inspects over 4,000 food facilities. We perform more than 7,000 routine inspections and over 1,500 follow-up inspections. We also receive and investigate over 400 complaints from residents each year, including complaints of foodborne illness, also known as food poisoning.
We'll show you the correct way to set up and use the 3-compartment sink to clean and sanitize to keep people from getting sick with a foodborne illness or from the detergent and chemicals that are used. When not cleaned properly in the 3-compartment sink, things like germs or chemicals can be on a plate, fork, even the food, and make someone very sick. The purpose of the compartments, or basins, is based on 3 important steps, which are washing, rinsing, and sanitizing. We'll show the steps to properly wash, rinse, and sanitize dishes, utensils, and equipment. Before you start, wash your hands. Then, thoroughly clean and sanitize each of the compartments and surface areas. Make sure you have working drain levers and drain stoppers. Keep this area clean throughout the day. A drain board or landing surface should be a part of your 3-compartment sink to properly air dry dishes and utensils. The first compartment is used for washing. Fill the compartment with hot water and add soap or detergent to make the wash solution. Use a calibrated thermometer to check the water temperature, which should be at least 110 degrees. The second compartment should be filled with only water to rinse the dishes. You can also use a sprayer to rinse in this basin. The final step is using a chemical sanitizer that will kill any germs, also known as pathogens, that may be on dishes, equipment, and utensils. Sanitizing keeps the food operation safe and prevents foodborne illness. Proper sanitation requires completing the first 2 steps of washing and rinsing. This step requires a sanitizer to be added to the water in the 3rd compartment. You may use chlorine bleach, quaternary ammonium, also known as quat, or an iodine solution. Sanitizing solutions should be at least 75 degrees, but check the label on the sanitizer for specific temperature requirements. To test the concentration of the sanitizer, use the test strips for the chemical being used. For chlorine or bleach solutions, the concentration should be between 50 and 100 parts per million, or ppm, and should never exceed 200 ppm. In most cases, for a standard 3-compartment sink, adding 1 capful of bleach to a full basin of water is sufficient, but it's important to test the concentration to be sure. When using chlorine test strips, dip the strip into the sanitizing solution and immediately remove the strip and compare to the color chart. For quat sanitizers, the required concentration is on the chemical label. Many quats have a range of 150 to 400 ppm, but be sure to check the chemical label to ensure you are using the correct concentration. For quat sanitizer test strips, it's important to dip the strip into the solution, avoid suds, and hold it still for 10 seconds. Be sure to use all chemicals in accordance with the instructions on the label. If your test strip shows that the sanitizer concentration is too high or too low, you will need to remake the solution to the proper concentration. For bleach, either dilute with more water or add small amounts of bleach and check the concentration with a test strip. If you use a quat sanitizer from a calibrated dispenser pump that is not dispensing the proper concentration, call your service provider. To determine if a sanitizer is chlorine or a quat, simply check the ingredients on the chemical label. A chlorine or bleach sanitizer will list sodium hypochlorite as an active ingredient. A quat sanitizer will list quaternary ammonium as an active ingredient. To make sure you're using the correct test strip, the label on the sanitizer test strip will either show chlorine or quat. Now, we'll show you the proper washing, rinsing, and sanitizing process. Before you begin, it's important to either scrape or pre-wash debris from the dishes and utensils into the trash. In the wash compartment, use a scrub brush or dishcloth to remove all remaining debris. The dishes and utensils are then placed in the rinsing compartment to remove any remaining traces of debris and soap or chemicals by either placing the item in the water or rinsing with a sprayer. It's important to keep the rinse water clean, so be sure to drain and replace as needed. To sanitize, the dishes and utensils are fully immersed in the sanitizer solution in the third compartment for the contact time specified by the chemical being used. This can range from 10 to 30 seconds of soaking time. Now that the dishes and utensils are sanitized, it's time to allow the items to air dry on the drain board or landing surface. Do not stack the items or dry with a cloth. Do not use a 3-compartment sink as a mop sink or for hand washing. Food prep should be done in specified sinks. Ensure you have a proper air gap on the drain line from the 3-compartment sink so that wastewater drains properly. Sink compartments should be large enough to immerse the largest equipment and utensils used in the facility. Maintain clean, wash, rinse, and sanitizing solutions. To ensure proper washing, rinsing, and sanitizing, be sure to drain and replace the solutions frequently and when the water is dirty. Do not mix soap and sanitizer. These methods apply to all dishes, utensils, and equipment. Food service workers that are washing dishes are required to wash their hands between handling soiled dishes and clean dishes. If someone touches a clean dish with dirty hands, the dish must go through the entire process. Do not use paper towels or rags as a drain stopper. Do not use bleach that is scented, color safe, or color care. Let's review how to set up and use the 3-compartment sink. First, we explained why using a 3-compartment sink is important and how to properly set up the sinks and surface. We took you through the steps of washing, rinsing, and sanitizing dishes, and discussed the types of chemical sanitizers, how they are measured, and why they are used. Finally, we provided some tips to help you run a safe operation. We hope you found this information helpful. If you have questions, please call 630-682-7400 or visit DuPageHealth.org.